brief really is in support of the current measures that the government has put in place in respect of the weather situation that we have at hand. And these are, again, advice from the Health Ministry in relation to what the Director, NDMO, has already alluded to. Currently, all health facilities remain open, manned by health staff, and who are ready and in a position to attend to any emergencies that may arise during this time. Our advice for situations like this, and in particular the flood risk and the flooding situations that we have around the country, has been alluded to by the Director NDMO, and I'd like to reiterate. During flooding, we have high risks of spread of infectious diseases such as typhoid, as well as leptospirosis. So we should be boiling all drinking waters as much as possible. In communities where water supply is affected, please boil all drinking water for your family and for yourself. Store water as advised for bathing and other household activities, and utilize the opportunity available to safely harvest and collect water around your home. Maintain hand hygiene and personal hygiene. Washing of hands for 20 seconds with soap and water. Use alcohol-based hand hygiene gel if you have access to this. And also we are advising maintain social distancing in response to the COVID threat that we have at the moment. For children and adults, do not play in flooding water. We have a lot of floods around our communities and our homes, and there is always a risk of getting leptospirosis from flooding waters. If you have to go outside, use proper PPE, including gumboots, and make sure you are not exposed to the risks of infections such as leptospirosis. As I've stated earlier, our health facilities remain accessible. If you have to access health facilities at this time, given all the risks that are around the communities, please contact the number that has been provided, 915, with the NDMO office, so that your movement from your home or your community to a health facility under the risks that we are in is well coordinated and safe. Cook food well and make sure they are covered from flies and other insects and pests, and make sure that food are stored well during this time. For those who have frozen foods that are stored for some period of time, make sure these are checked with the fluctuating power supply that's affecting some of our communities, and make sure the family does not consume damaged, frozen, or food that has deteriorated during this time. The Ministry of Health has plans to reach out into affected communities as soon as the cyclone is over, to assess, treat, and help with source reduction. To conclude, I reiterate the message from the Director NDMO. At this time, stay home and stay safe. And when you stay home at this time and safe from the hurricane, we will also save lives against the COVID-19 outbreak that's before us. Thank you very much.